Fall is approaching, and that means we are entering flu season. But is getting a flu shot still a good idea during this COVID-19 pandemic? So many questions for parents. So we have Stanford pediatrician Dr. Stephanie Hansen in today to talk a little bit about why it's important to get immunized and kind of break down the differences when it comes to influenza. And then we're going to talk a little bit, because we're hearing some good news, maybe that there'll be a COVID vaccine for our littles, maybe by Halloween. So thank you for coming in today. First, let's talk a little bit about the increased risk for flu, the influenza this time of the year. Are we moving into that season?
You know, we sure are. Influenza, just to remind people, is a respiratory illness. So in many ways, it's quite similar to COVID-19. You could have fever, cough, nasal congestion, body aches, and it's spread the same way. It's a respiratory virus. So we didn't see a lot of flu last year because everyone was so good about mask wearing in our communities, and we were practicing social distancing. So we had record low numbers of flu last year. This year, I think, is shaping up maybe to be a different story. We're seeing a lot more respiratory illness in the community, and I think we'll see influenza as part of that.
Yeah, I was going to say, even just the colds, I've noticed since the kids have been back, and depending on your school district, not seeing as much masking. You're just seeing the bugs out there.
Yes.
Can you expand a little bit more on the fact that they are very similar? Because you have that story 100 times. Like, is it the cold? Is it, the flu? Is it COVID?
Right.
They're all very similar.
They really are. And when you think about, we're also in allergy season.
Right.
We've been talking about that. So, runny nose, cough, irritated throat, maybe some fever on top of that, maybe feeling a little bit crummy. That could be any number of things. And so I do think it's important, while we're in this pandemic time, to really have that conversation with your primary care provider and say, how do I know when to get tested? Or, my child is having these symptoms. What should I do?
Do you have a couple of key things, 1, 2, 3 things, if they're happening, you should see your doctor or get tested?
Well, I think a fever is definitely kind of a no-brainer. That's a time where you really do want to be tested. But we've seen COVID present in a variety of ways of kids, and I honestly can't tell by looking at you, what flavor of thing you have that day. So testing is really the only surefire way to know what you're dealing with.
So there is a lot of debate over the COVID vaccine. We're going to get into that in a minute. But first, can we talk about the influenza vaccine?
Yes.
Why should you get that? And you can just get that at your well child check or some blitzes, right?
Absolutely. So we've made it very easy for people to access flu vaccine, and the time is now. We've started offering flu vaccine, and it's really not too early in the season to have that for your child or for your family. So you can access that through a blitz. We're doing drive-up blitzes at the Fargo Dome. We have nurse visits available in the clinic, or you can do it as part of any appointment, either in primary care at your checkup, at the urgent care if you are coming in sick, or if you happen to be seeing a subspecialist. You can get flu vaccine at any of those places.
Do you have to be concerned? Can you get the COVID vaccine at the same time you get your influenza vaccine? Do you need to spread them out? What do you need to know?
It's a great question. You can actually do them together on the same day.
Same day.
Yeah.
And how about, let's discuss possibly 12 and under, 11 and under may soon. What are your thoughts on kids being able to get the flu or the COVID vaccine?
Yeah, so right now COVID vaccine is available for anyone 12 and up. We highly encourage it for anybody in that age group. We think it's safe, and it's one of the best strategies we have for helping to combat COVID-19. What we're hearing is that very soon we'll see an application to the FDA for approval down to the age of 5. And that approval could happen, and we're hoping, maybe as early as the end of October or early November. And at that point, we'd recommend that kids in that age group get vaccinated as well.
And so parents are just not sure yet, or we were talking about this, you can find information on what you want anywhere, but the best place is really to talk to your pediatrician.
Yes, and again, I'll always say that relationship with your pediatrician is so useful, because that's the person you trust to help guide you in those healthcare decisions for your kids. So, send them a message, give a call, ask them about it when you're there for a checkup, and I think they'd be happy to talk to you and answer any questions that you have. Okay,
so I don't know that we have the exact dates. We'll get those up, but you're going to make it easy with the blitzes.
Yes.
For COVID as well. If COVID vaccines.
Yeah. I think when that time comes that we see approval, we'll be looking at what's the demand in the community and be there to provide it in an easy way for families.
Okay. Well, great to visit with you. Thank you so much for coming in. Lots of questions, lots of debate, but everybody wants a healthy kid.
Right.
So we're all on the same page there. Stay with us. Coming up next, coming together to make Fargo-Moorhead a great place for everyone. It's United Way's community kickoff event. Stay with us.